Okay, good afternoon, and thank you for joining our briefing on the City of Philadelphia's response to COVID-19. And we will begin our briefing with opening remarks from Mayor Kenny. Mayor, you have the floor.
Thank you, Mike. Good afternoon, everyone. As you can see, I'm still in quarantine, so I wasn't able to join other elected officials this morning at the Leah Center. City Commissioners opened 7 satellite election offices to provide Philadelphia voters with easier access to register to vote and to vote by mail. The offices will be open 7 days a week and remain open through Election Day, November 3rd, 2020. In addition to being able to register, voters may also request a mail-in ballot in person, receive it, vote, and return it all at the same location. In addition, voters could bring already voted ballots. In the midst of the pandemic, these satellite offices will help ensure that Philadelphians can access the resources they need to vote. This is particularly crucial for those who lack digital access and who need to avoid longer trips because of health risks. I thank the City Commissioners for their work in meeting this need with these offices. For more information, please go to philadelphiavotes.com. And remember, no matter how you do it, please make sure you have a plan to vote on Election Day or before Election Day. This is critically important to our entire region. Now I'll turn it over to Dr. Fardy for his update.
Thank you very much, Mayor. Last week was very similar to the previous week in the coronavirus epidemic in the city, which is generally good news because the last week was a sign of decline over the weeks before. Now, I do have several revisions on how we count cases to explain today, though. So here are the numbers. Since this time yesterday, we've identified 59 new cases of confirmed coronavirus infection in Philadelphia residents. I want to give you an explanation before I give you other numbers. First is a correction on the total number of confirmed cases to date. Here's the explanation behind that. We get tests reported directly to us from most laboratories in the region, but not all. And the State Department of Health gets tests reported directly to them by most laboratories in the region, but not all. And we send files back and forth daily between us at the Philadelphia Health Department and the State Health Department to get the cases that they have that we don't know about and to have them know the cases that we know that they don't have about. That matching is a complicated process. It involves computer steps and involves a human review. We recently discovered that there were 376 cases in Philadelphia residents who were tested between March and August of this year that were not identified in this process. Those are going to be added to our database today. So the total number of confirmed positives today is 36,887, not 36,511, which is what you would get if you were to add today's newly case reports to yesterday's total. Now that correction, adding those 376 previously missed cases, increases the total case count by just about 1%. And it doesn't change the overall shape of the epidemic wave or interpretation of where we are in the epidemic. And it doesn't change the case count here in September. The 2 other data issues I want to talk about. First, each day we report the number of new positive test results we received since the previous day. We'll continue to do that. But because the data comes to us from laboratories after a delay in batches, the graph on our website shows the data by the date in which the test was run in the laboratory. That's the way we did it from the beginning of the epidemic. But starting today, we're going to make 2 changes in the way that we show the data on this graph. First, we're going to change to graphing it by the date of sample collection. It's the date that someone was in a test site and had the test swab collected, rather than the date in which the test was run in the laboratory. The advantage of this is that by graphing by the date of the sample collection, when a person was at a test site, it makes the graph closer to reflecting what is actually happening with the epidemic. And it won't be distorted by the time it takes for the lab to run the tests. And that time is variable according to which laboratory the test went to. So last week, by date of sample collection, we averaged 74 confirmed cases per day, a total of 517 cases for the week, and 2.5% of people tested positive. Those numbers are similar to what we had the week before. Now, as always, there's delays that we get for some of the reporting, so those numbers are likely to grow a little bit with late reports. Now, the second change we want to talk about today as far as data reporting is that we will start reporting separately the number of people with positive rapid tests. Now, the rapid test machines are appearing in more places now. More people are getting these rapid test results. That's good, but the results may be false positive. And not everyone gets a standard test, a PCR test, to confirm a positive test to be sure that it is actually positive. So if we get a positive rapid test without a confirmatory standard PCR test, we're going to call that a probable case. It's the same things that other jurisdictions around the country are doing. Since the beginning of the epidemic, we have only 180 probable cases from rapid testing. But we do expect this number to grow as rapid testing becomes more popular. For last week, we have 50 probable cases from rapid testing for the entire week that we'll be adding, and that we'll be displaying on our website. Now, a couple of notes here in interpreting this. Not all rapid tests are reported to us, and we're working with sites to get them to give us this data. So our number of these probable rapid tests will be incomplete, but we will report what we get. Second thing to note is that if a person has a positive rapid test and later gets a confirmatory PCR test, we will convert that person from a probable case to a confirmed case, which means that our probable case count may actually go down over time. That's where we are with case counts. Now with the epidemic otherwise, in schools, fortunately, we are not seeing any clusters of infections in any of the kindergarten through 12 schools that are open so far. We have seen isolated cases in staff and in students. We have no evidence yet of spread within schools of the infection. As far as cases now, as far as deaths, we have one additional death to report from the coronavirus infection, bringing us to a total of 1,801 since the beginning of the epidemic. Our data on deaths comes in batches. We're averaging about 1 to 2 per day right now. And our graph on the website is by the date in which the person dies, and that's not going to change with these other changes. That's what's happening in Philadelphia. Now, in Pennsylvania as a whole, you're seeing that daily case counts have been pretty much level over the past week. But in the United States as a whole, case rates are now rising. They're still rising they were rising a couple of weeks ago, and they're still rising. They're particularly rising in the big center of the country. North Dakota, South Dakota, Wisconsin, Iowa, those sites are seeing very sharp increases of their infections. Back here in Philadelphia, what's new on testing? We continue to put more information on our website, www.phila.gov/testing, where you can go to get tested. The rapid tests are increasingly available at the different test sites. There are machines in nursing homes, and these card tests was announced yesterday. The federal government will be distributing these tests that can be done on cards that don't require machines. They're going to be distributed to the state of Pennsylvania, and we hope in the city of Philadelphia sometime soon. I don't have more details on that, but look forward to knowing more about that. Last week, we issued guidance to doctors about how to use and interpret these rapid tests. The key messages for doctors, which other people might need to know as well, is that these tests can have both false negative and false positive results. The likelihood that a result is false negative or false positive really depends on the situation for the person who's tested. And that people may need a standard PCR test to confirm either a positive or a negative result. And any clinic that is setting up these rapid tests, particularly with the card tests, don't have machines that maybe many clinics doing that, they need to report the results to the health department so that we have the data so that we can track the epidemic. Now let me move on to our social distancing restrictions. Our falling case counts in Philadelphia over the past few weeks show the success of our strategy. Our strategy involves containment, that's testing and contact tracing and isolation and quarantine, and then also the social distancing restrictions. Limits on people gathering together and trying to keep people separate, and the use of masks. I said that as case counts fall, we would scale back restrictions gradually and carefully. Now, the governor announced recently that he would allow restaurants to expand to 50% capacity indoors effective September 21st. Here in Philadelphia, because our case counts have been falling, we will allow restaurants in Philadelphia to do the same, to go to 50% capacity for indoor dining effective this Friday, October 2nd. It's important, though, to know that there are other restrictions here. First, under the governor's rules, if restaurants want to do this, they must self-certify on a website that they're following state and CDC safety guidelines. The safety guidelines are very important. Restaurants also must follow the city rules, including these rules, that the tables have to be spaced so that all diners at different tables are at least 6 feet apart. People can be closer to that within a table, but a diner at one table has to be more than 6 feet apart from a diner at another table. The tables themselves can have 4 or fewer seats, no more than 4. The idea is we want only household members to be dining together. We don't want people from different households to be dining together because that'll increase the opportunity of spread between households, which is a big part of our problem right now. There's no seating at bars. No alcohol will be served except during a meal. These are state rules that we strongly endorse because bars are clearly even higher risk settings than restaurants. And the city rule is that servers have to wear masks and face shields. That's because the servers themselves, who are going to be in contact with many people dining there not wearing masks, are going to be at the greatest risk. And we encourage all restaurants to improve their ventilation, such as opening their windows and doors or optimizing their heating, ventilation, and air conditioning systems. But no matter how much restaurants improve the ventilation indoors, the ventilation outdoors is going to be much better. So even as we're expanding the opportunity for restaurants to have more diners indoors, we want to encourage restaurants to have outdoor seating, and if anything, to increase their outdoor seating, because we do think that's a much safer environment for diners. So that's what we're doing with restaurants right now. I can tell you that we will be looking at our other social distancing restrictions, and we will scale back others as appropriate. But let me remind everyone that if case rates start to rise, which they very well could as weather gets cooler, depending on what's happening around the rest of the country, we may have to reimpose some of these restrictions. And finally, just a reminder that much of the progress we've made really is because people are wearing masks. I note today that the percent of people who are wearing masks in our observations, as we see in the graph posted on our website, has fallen in the last couple of weeks. And our observations has gone from in the 90% range to 80% and now 76%. Now that may just be random variation. There's going to be random variation from week to week in our observations, but definitely it's a reason for our concern. So we need to keep this up, especially as the weather gets colder and people move inside. People need to wear masks. When do you need to wear a mask? Whenever you're indoors around people other than your household members, whenever you're outdoors within 6 feet of people other than your household members. All of our information is on our website, www.phila.gov/COVID. Thanks.
Thank you, Dr. Farley. And now we will go to Armando for the translation of the mayor's and Dr. Farley's remarks.
Palabras del alcalde Jim Kenney para el 29 de septiembre del 2020. Buenas tardes. Como pueden ver, el alcalde Kenney se encuentra todavía en cuarentena y por eso esta mañana no pudo reunirse con otros funcionarios de la ciudad en el centro de Acuras. Los comisionados de la ciudad abrieron 7 oficinas electorales satélite para brindarles a los votantes de Filadelfia un acceso más fácil para que se registren en el padrón electoral y puedan votar por correo. Las oficinas estarán abiertas los 7 días de la semana y permanecerán abiertas hasta el día de las elecciones, es decir, el 3 de noviembre del 2020. Además de poder registrarse, los votantes también pueden solicitar una boleta por correo en persona y tras recibirla, votar y devolverla todo en el mismo lugar. Los votantes que ya tengan su boleta también pueden traerla y entregar su voto en estos locales. En medio de la pandemia, estas oficinas satélite ayudarán a garantizar que los habitantes de Filadelfia puedan acceder a los recursos que necesitan para votar. Esto es particularmente crucial para aquellos que carecen de acceso digital y que deben evitar viajes más largos debido al riesgo para su salud. Les agradezco a los comisionados todo su trabajo para satisfacer la necesidad de nuestros residentes con estas nuevas oficinas. Hay más información que se encuentra disponible en español en philadelphiavotes.com. Y recuerde, sin importar cómo lo haga, pero por favor, haga sus planes ahora para ejercer su derecho al voto. Muchas gracias. Y esta es la actualización en materia de salud para el 29 de septiembre del 2020. Hoy comenzamos con buenas noticias. Continúa el censo de los casos y ahora les comparto detalles sobre cómo nosotros contamos los casos. Desde ayer se identificaron 19 nuevos casos. Queremos ofrecer una explicación. Asimismo, queremos anunciar una corrección en el número total de casos hasta ahora. En el Departamento de Salud de Pensilvania recibimos directamente los resultados de muchos laboratorios, pero no todos. Todos los días usamos nuestras bases de datos con las del Departamento de Salud del Estado para el número de casos. Hacer esta verificación es un proceso complicado. Descubrimos que 376 casos, cuyas pruebas se realizaron entre marzo y agosto, no fueron identificados a través de este proceso. Por lo tanto, hoy añadimos casos a nuestra base de datos. Por lo tanto, el día por los 87 casos en vez de 36.511. Esta corrección aumenta el número de casos en aproximadamente 1%. Pero esto no cambia la forma en la que la epidemia se ha estado comportando. Y tampoco cambia el conteo de casos del mes de septiembre. También aprovecho esta oportunidad para compartir otras consideraciones sobre el manejo de los datos. Cada día informamos el número de nuevos resultados positivos que recibimos desde el día anterior. Y continuaremos haciéndolo. Pero debido a que los datos provienen de laboratorios y muchos resultados se presentan con retraso, el gráfico en nuestro sitio web muestra los datos clasificados según la fecha en la que se realizó la prueba. Pero comenzando el día de hoy, se podrá observar dos cambios en la forma en la cual presentaremos los datos en nuestros gráficos. El primer cambio en el gráfico es que se mostrará la fecha de la recolección de la muestra en vez de la fecha en la cual se realizó la prueba en el laboratorio. La ventaja es que los gráficos por fecha de recolección de la muestra, es decir, cuando una persona fue a un sitio de prueba, hace que el gráfico refleje lo que realmente está sucediendo con la epidemia. Los casos de la semana pasada, por la fecha de recolección de la muestra, son los siguientes. En promedio, tenemos 74 casos diarios, es decir, 517 casos por semana, un 2,5% de casos positivos. Estos resultados son más bajos si los comparamos con los de cualquier semana desde la primera semana desde la epidemia. Si se ve por fecha de ejecución de la prueba, tenemos la misma buena noticia. En segundo lugar, comenzaremos a informar por separado la cantidad de resultados de las pruebas rápidas positivas. Hay máquinas de prueba rápida en más lugares, por lo tanto, hay más personas que obtienen los resultados de sus pruebas. Los resultados, sin embargo, pueden ser falsos positivos. Pero no todo el mundo se hace una prueba de PCR estándar para confirmarlo. Si obtenemos una prueba rápida positiva sin una prueba PCR confirmatoria, nosotros lo llamamos un caso probable. Desde el comienzo solo tenemos aproximadamente 180 casos probables, pero esperamos que este número aumente. Hubo 50 casos probables que fueron reportados la semana pasada. Es importante destacar que no fuimos informados de los resultados de todas las pruebas rápidas, por lo que nuestros números aún están incompletos. Y estaremos informando los datos a medida que los recibamos. Si la persona con una prueba rápida positiva obtiene un resultado de una prueba de PCR positivo, este caso pasa de ser probable a ser un caso confirmado. Por lo tanto, el recuento de casos probables bajaría. No hemos visto brotes de contagio en las escuelas que están abiertas desde el jardín de infantes hasta el 12º grado. Hemos observado casos aislados sin evidencia de propagación. Tristemente, reportamos un fallecimiento con un total de 1.801 casos. Recibimos los datos en grupo y el promedio es de 1 o 2 muertes diarias. El gráfico en el sitio web muestra la fecha del fallecimiento y ese dato no lo modificaremos. Con respecto al estado de la epidemia en Pensilvania y en el resto de los Estados Unidos, vemos que en nuestro estado los casos se mantienen en el mismo nivel de la semana pasada. En los Estados Unidos, los casos van aumentando, particularmente en el centro del país, Dakota del Norte, Dakota del Sur, Wisconsin y Iowa, por ejemplo. Con respecto a las pruebas, usted puede conseguir toda la información disponible en fila.gov/testing. Las pruebas rápidas están cada vez más disponibles. Hay máquinas de prueba rápida en los hogares de ancianos y las tarjetas para las pruebas se distribuirán muy pronto. Hay también nuevas pautas para los médicos que se dieron a conocer la semana pasada. Y quisiera también compartir algunos mensajes. Las pruebas pueden dar un resultado falso positivo o falso negativo. La probabilidad depende de la situación de la persona evaluada. Se podría requerir una prueba PCR para confirmar si alguien tiene el COVID-19 o no. Las clínicas deben reportar sus resultados al Departamento de Salud. Por lo tanto, nosotros tendremos los datos. Hay algunas consideraciones respecto a la distancia social. La disminución de los casos en Filadelfia nos muestra el éxito de esta estrategia. La fase de contención ha tenido buenos resultados. Las pruebas, el rastreo de contactos, el aislamiento y la cuarentena han ayudado a contener la propagación del virus. La distancia social, las restricciones en el número de personas y el uso de las mascarillas ha sido otro elemento de la estrategia que ha funcionado para nosotros. Hemos dicho que eliminaremos las restricciones gradualmente a medida de que el número de casos disminuya. El gobernador permitió que los restaurantes expandieran su servicio en interiores al 50% de su capacidad el 21 de septiembre. Nosotros haremos lo mismo en Filadelfia, pero a partir del viernes 2 de octubre. pero esto estará acompañado de otras restricciones. Primero, según las reglas del gobernador, los restaurantes deben autocertificarse siguiendo las pautas de seguridad estatales y las de los Centros de Control de Enfermedades. Los restaurantes deben de cumplir con las reglas de la ciudad también, y estas incluyen las mesas espaciadas de modo que los comensales estén separados por más de 6 pies, mesas de 4 o menos asientos. Solo los miembros de un hogar deben sentarse juntos, de lo contrario aumentará la propagación entre los hogares. No habrá servicio de bar. Las bebidas alcohólicas se servirán solamente durante la comida. Nosotros respaldamos las reglas estatales firmemente, porque los bares son entornos de mayor riesgo que los restaurantes. Los meseros deben usar máscaras y protectores faciales, ya que son ellos que están en mayor peligro. Animamos a mejorar la ventilación, abriendo ventanas, puertas y optimizando el sistema de aire acondicionado. Y no importa cuánto mejore la ventilación en interiores, siempre será mucho mejor cenar en exteriores. Por lo tanto, animamos a los restaurantes a mantener o aumentar sus asientos al aire libre. Y observaremos otras restricciones y reduciremos otras según corresponda. Gran parte del progreso que hemos logrado se debe a que las personas están usando las mascarillas y necesitamos seguir haciéndolo, especialmente cuando hace más frío y hay más gente adentro. Así que les pedimos a las personas acostumbrarse a hacerlo correctamente. ¿Cuándo usar las mascarillas? Siempre que esté adentro con personas que no sean de su hogar. Siempre que se encuentre al aire libre, a menos de 6 pies de distancia de otras personas. Juntos podemos ganarle al COVID, así que cuida de ti y de tus seres queridos usando la mascarilla. Muchas gracias.
Okay, thank you, Armando. We're now going to move to the Q&A portion for members of the media. And joining us today is Acting Managing Director Tumar Alexander. And again, this briefing is on topics related to the COVID-19 pandemic, including the easing of restrictions for indoor dining just announced by Dr. Farley. If you have questions on any other topics, including the election satellite offices and the encampments on the Parkway and Ridge Avenue, please hold them to the second round of questions. And joining us for questions on the protest camps is Deputy Managing Director Eva Gladstein. So if your hand is raised now and your question is not on COVID-19 or the related topic of indoor dining, please lower it and we will announce a second round when we get to it. Only one representative from each outlet is permitted to ask questions in the first round, and reporters are asked to limit their questions to 3 or fewer. And with that, let's go first to Jeff Cole of Fox 29.
Yeah, hi, folks. Questions for Dr. Farley on 50%. Dr. Farley, the Restaurant Association will argue they've lost 20 to 30% of restaurants statewide. And one of the things they're saying is to continue to restrict bar service and to restrict the idea of people being able to get a drink without food, they think will continue to drive their industry under. And they say that to continue to do it, they think people will go rogue, that people are having backyard parties, and it prompts that sort of thing where the spread of COVID might be more severe. What are your thoughts about that argument?
Well, first, I'm sympathetic to the restaurants and bars that are losing revenue through this. It's really been tough on them. On the other hand, we absolutely know that bars are high-risk situations. They're clearly higher-risk situations than restaurants. Lots of examples around the country of rapid spread within bar situations around the world as well. And so that adding bar service would absolutely increase the risk. And I don't think there's any evidence that says if you shut bars down, that just drives the behavior elsewhere and you have the same level of risk elsewhere. Just the opposite, in fact. There was a big outbreak in the Pittsburgh area a couple months back. They shut down bars and quickly the outbreak was quelled. So again, I'm sympathetic to them, but that bar situation is just too risky right now.
Doctor, do you have any thoughts about putting together a winterization task force or thinking about and offering guidance about restaurants staying open through December and actually having outdoor dining in the winter? They're wondering about that as well. What are your thoughts there?
Yes, I know that people at the Department of Commerce are talking to people in the restaurant industry about ways that we can make it easier for restaurants to offer outdoor dining as the weather gets colder, I think that's an excellent idea, and we would be supportive of that. As long as they can maintain the high level of ventilation that occurs outside and have people be comfortable outside, that is absolutely safe for environment.
The last question I have for you. I think there's a House Bill 2513 in the legislature that's passed the House, passed the Senate. Senate has to sign it. The governor doesn't seem interested in it, but it does seem to pull away a number of the restrictions that you and the state wants to hold in place around dining. If they were to override the governor's veto, do you think that bill is simply not good for the health of the state, not good for Philadelphia?
I don't know what's in that specific bill. I do know that there's been a number of bills that the legislature have proposed to override the governor's safety restrictions. I think all of them are a bad idea. I think that the governor has done an excellent job at protecting the residents of Pennsylvania with his restrictions. I understand that those restrictions are tough on businesses, but we don't want any more people to die than is necessary. And I think the legislature should allow the governor to act as he has.
Thank you.
Thank you, Jeff. And now we will go to Laura McChrystal of the Inquirer.
Hi. First, a question for Mayor Kenny. You mentioned you are still quarantined. Have you been tested again, or when will you be, and when does your quarantine end?
Quarantine ends next Monday, the 5th. I thought I was mistaken. My doctor, I didn't understand my doctor. I thought I was getting tested yesterday, but it won't be till the 5th.
Okay. And a question for Dr. Farley about the rapid tests. You mentioned that they're being categorized as probable cases because they can have false results. So if someone gets a rapid test, what would your advice be to them? Like, should they trust the results either way, or how should they treat that?
It really depends on the situation. If someone has classic symptoms and has a positive test, that's very likely to be positive. They probably don't need a confirmatory test. On the other hand, if they have no symptoms and they have a positive test, it could be a false positive. They probably need a confirmatory test. And if they have classic symptoms and they have a negative test, that could be a false negative. They probably need a confirmatory test. We've given very specific guidance to doctors about how to handle different situations like that.
Okay, and even with all the potentially confusing situations, that they are still something that you recommend as a tool for testing?
I think that they are valuable in certain situations, but because they're not perfect, they have to be used carefully. I think the best situation is for people who have classic symptoms, of fever and respiratory symptoms, because if you get a rapid result, then you can more rapidly do contact tracing and all the work around prevention. For somebody without symptoms, they're probably not the best idea.
Okay, that's all from me.
Thank you, Laura. Let's go to Jack Tomzik of Metro.
Hello, this is for Dr. Farley about indoor dining. So with the number of chairs at each table limited to 4, does that mean a family of 5 cannot go to indoor dining? And if so, how did you come up with the 4 number?
That is correct. And certainly any number you put there might be some people with households larger than that. But certainly if you have a table with, say, 6 seats, that's too many opportunities for people to just decide to get together with a group of friends and be spreading between households. So it's not a perfect limit, but it is a limit to try to send the message that this is really just about people within households. And I'm sorry, if you have a household of 5 or more people, you're not going to be able to eat out inside. And
my second question is about the limit of 25 people indoors. Does that apply to these restaurants? So can a restaurant with a capacity of 100 have 50 people, or do they still have to have 25 or less?
No, that 25 limit is for gatherings. That does not apply to restaurants.
Okay. And has there been any thoughts about lifting that or expanding that now that it seems like more restrictions are being lifted, expanding the 25?
The indoor gathering limit of 25 is a state restriction in addition to a local restriction. As I said, we are looking at our restrictions to see what might be appropriate to scale back on. But likewise, the governor would have to make similar changes in order for that to change.
All right. Thank you.
Okay, thank you. Let's go now to Martin Pratt of Philly YBN.
These 2 questions are for Dr. Farley. Dr. Farley, yesterday the president mentioned, or at the president's press conference, there were 50 million tests being distributed Are you aware of when Philadelphia will get its version of that test?
I'm not yet. This is the Abbott Binax Now card. These are tests that can be done without having a special machine. They still need to be done in a clinic. There's still restrictions to them. You have to have special training. You need to do them correctly to get the correct result. I'm told that there's some 100 million of these cards that are going to be distributed to state health departments. And the state health departments, in turn, are going to have to figure out where to distribute them to. I haven't heard when they will arrive or how we might receive them here in Philadelphia.
Would you, could you rather explain whether that really impacts the spread of the virus, whether or not having rapid tests actually impacts it? Because the White House was basically saying this is a reason for cities to open the schools, and as we know, that's problematic. But I would love for you to be able to explain to my audience what would be the reasoning for Philadelphia to reopen the schools versus just having access to rapid tests.
Rapid testing is one tool that can help us respond to the epidemic. It is not going to revolutionize everything. And in general, let's remember, a test by itself doesn't prevent the virus from spreading from one person to another. All a test does is give you information that you might be able to act on. So the potential advantage of the rapid tests is for somebody who has symptoms to identify quickly whether that person has COVID, so that you can have that person go into isolation and you can start your contact tracing and have their contacts go into quarantine very quickly. The disadvantage is you may have a false positive result. And also, remember, this test is not a home test. It needs to be done in a clinic. And so unless a school has a clinic, they're not going to be able to do it in the school itself. So I do think that there's a value in this in evaluating students or staff who have classic symptoms of COVID so that they can quickly start the process for containment if they have a positive result. But it's going to be a while in figuring out how to make it available to those people. And it's still not going to prevent spread from people who don't follow isolation and quarantine or don't get tested in the first place.
Thank you.
All right. Thank you, Martin. Let's go to Manny Smith of CBS 3.
Hey, good morning or good afternoon. A couple questions from our team today. Our question number one is for Dr. Farley. The American Academy of Pediatrics says there was an 18% increase in COVID-19 cases in children between September 3rd and the 17th. Any thoughts on what you think is causing this and any concerns about the new trend?
I hadn't seen that data. I can only speculate that during that time period is when we had college outbreaks across the country. And it may be that college-age students are likely to be in contact with younger siblings, or maybe that some of them actually fell in as pediatric cases themselves, and that was connected to that wave.
Also for Dr. Farley, again, and forgive me if this is the second time answering, just wanted to get a square answer on it. The school district has been open about wanting to return to public schools, return to in-class instruction in November. Right. What are your thoughts about that? And where are you in communication discussions, planning for that with the district?
We have issued safety guidance for schools, both elementary schools and middle and high schools. And it is our position that schools can open safely, both public schools and private schools. As you know, the parochial schools are offering in-class education and independent schools as well in Philadelphia right now. And as I said a few minutes ago, we have no evidence yet of spread within those school buildings for the schools that have opened up in person. So we do think a lot of safety procedures need to be put in place, but we do think that the schools can open for in-person education in November, as they've discussed, in a safe way.
All right. And my last question is listen, we're all encouraged by the positive trends and numbers that have been happening kind of globally in the city. Is there anything or any activities or any behaviors that you're still seeing in the city that you want people to stop doing or do less of?
It's very clear that the major way the virus is being spread right now is within households and then between households and their close friends and relatives, often through small social gatherings. So I try to emphasize that in previous press conferences, that when you have your uncle visit, or you're visiting your grandparents, or you're visiting your cousin, or you're visiting your neighbor, these are people you tend to trust, and you tend not to wear a mask around them. But those are the people that you're most likely to get infected by, so you need to be wearing a mask and have them wear a mask when you get in contact with those folks. And then everybody should be staying away from social gatherings, parties. We all want to get together. We're humans, we're social animals, but getting together indoors without masks is a very high-risk situation.
Thank you, Dr. Farley.
Thank you, and thank you, Manny. Let's go now for the end of the first round to our Henny's Figueroa of Univision.
Hello, good afternoon. Okay, my question is going to be for Dr. Farley, but I need translation from Armando. Armando, ¿cómo estás?
Buenas tardes, Argenis, bienvenido.
Bien, gracias. Armando, mi pregunta es para el Dr. Farley y es simplemente preguntarle si ese 50% que están permitiendo en el indoor dining pudiera mantenerse hasta cuando venga la temporada fría.
The question is to Dr. Farley, and it is whether that 50% allowed for indoor dining will be maintained until the cold weather is with us.
That 50% allowed will be maintained as long as we think it is safe. So if case counts continue to be low, we don't have evidence of spread within restaurants, we will continue to allow the restaurants to do that. If case counts begin to rise and we have evidence or we have evidence of spread within restaurants, then we'll reconsider that. We do recognize it's a high-risk situation, and so we want to again re-emphasize, including for Spanish-speaking audiences, that we want to encourage the restaurants to take advantage of outdoor dining as much as possible.
El 50% se va a mantener siempre y cuando las tasas continúen estando bajas, no tengamos evidencia de que hay un contagio dentro de los restaurantes, así que les permitiremos haciendo esto. El número de casos continúa elevándose, tenemos pruebas de que el virus se está esparciendo a través de los restaurantes, lo reconsideraremos. Esta es una situación de alto riesgo y quiero enfatizarle especialmente a la comunidad hispana que queremos alentarles a que los restaurantes hagan uso de sus espacios al aire libre tanto como sea posible. Gracias.
Perfecto, muchas gracias, Armando, es todo.
Bueno.
Henny's, are you finished?
Thank you. Yeah, I finished. Thank you so much. I finished.
Very good. Okay. We're now going to a second round. We'll open the floor to questions on any topic. And first up is Joe Brandt of NBC 10.
Hey, folks, can you hear me?
Yep. Go ahead.
Okay, two questions about the election. First, we talked about the satellite locations. We had a reporter out at the Leah Corus Center today. There was some sort of system issue. I know it's been maybe an hour or two. Is there any update on that, when that might be resolved? I know the state has to work on it. Anything more you can say on that?
My understanding was that I think five were back and 2 are being worked on. And it's the first day, so it's not uncommon for tech to go down on day one. You have anything else, Mark?
Yeah, Mayor, just a quick update. Just got a text from the city commissioner, Dealey. They now have 6 of the 7 sites back up. The only remaining site that they're working on is Tilden Middle School.
Okay. All right, thank you for that. And then the other question is about this. There's a lawsuit it's filed by actually some state reps from mostly central PA, critical of a grant that the city and I think Delco and Center County had received, basically saying that they want to block the use of this grant. And it's my understanding that grant was used for various things, including opening polling places, setting up the satellite offices. Do you have any comment on the suit? It's like Daryl Metcalf and a few other people are on it. Okay.
Well, that tells you about it right there. This is Daryl Metcalf. They could always provide us with the money we need to open up all the polling places in an effective way. But I don't know anything about the suit, haven't read it, so we'll check with the solicitor and get back to you.
Okay. Yeah, it was the Center for Tech and Civic Life.
Yeah, I'm familiar with the grant. I'm just not familiar with the lawsuit.
Okay. Thanks.
Joe, did you have anything else? Joe, you're
Yeah, I'm good. Thank you.
You're good. Okay. Let's go now to Sir Marie Lobos of Telemundo.
Hola. I need that if it's possible to answer in Spanish. Armando, hola.
¿Qué tal?
Muy bien. Primero, queremos saber si es posible que se nos confirme que la ciudad está en efecto en un proceso de negociación para proveerle al menos 50 hogares a las personas sin hogar que se encuentran en los campamentos, y de ser cierto, si son las residencias que ellos nos han estado mostrando en videos que no parecieran estar aptas para que nadie pueda vivir en este momento.
The first question is a possible confirmation that the city is in fact in negotiations about furnishing homes to the homeless that are in the camps at the present time. And if these residences are the ones that were shown to us in videos that did not seem fit for human occupation.
Well, we're still in the midst of conversations with them. We're making progress. 22nd Street is open. We're hoping to resolve it peacefully, but we'll have no specific comments on items that we're negotiating until it's completed.
Estamos haciendo un buen avance. Estamos en conversaciones, sobre todo con la gente que está alojada alrededor de la calle 22, que está abierto. Entonces, vamos a seguir negociando hasta que esto se complete.
¿Hay alguna fecha para que estas personas salgan y se les brinde esos hogares que ellos están pidiendo?
Is there any date into the future for these people to abandon those camps and to move on?
As soon as possible.
Tan pronto como sea posible, Sir María.
¿Hay una confirmación de que se le está haciendo una oferta de 50 residencias para ellos?
Can you confirm that there's been an offer of 50 residences offered to them?
Not going to get into any specifics of negotiation until they're complete, and then we'll lay it all out for you when it's finalized.
No puedo revelar ningún detalle de las negociaciones. Están haciendo que estas negociaciones concluyan y en ese momento daremos toda la información.
Perfecto. Tengo una pregunta de otro tema, Armando. Nosotros reportamos que el pasado domingo una familia de Guatemala sufrió una invasión de morada y fueron agredidos fuertemente. Incluso se amenazó con llevarle a su niña de 7 años si no les entregaban el dinero. Estas personas aparentemente fueron víctimas de este robo porque son personas inmigrantes, y hay una sospecha de que hay una modalidad con estas personas. ¿La ciudad tiene algún ofrecimiento para estos inmigrantes que están haciendo estas denuncias? Sabemos que aparentemente de forma histórica las comunidades asiáticas habían sido también blanco de este tipo, porque pues la gente no confía quizás en los bancos o no puede por no tener documentos para depositar su dinero en los bancos y guarda su dinero en efectivo en sus residencias, por eso son víctimas de estos ataques. ¿La ciudad tiene alguna forma de proveerles seguridad o algún tipo de oportunidad para esta gente?
This is a question in regards to a report that we had. Last Sunday, a Guatemalan family was the victim of a home invasion. And this is, they even threatened with taking away their 7-year-old daughter. And this is theft. This was connected with money. And this is something that happens with immigrant communities, apparently. And this is something that has been happening traditionally with Asian families or Asian communities. Is the city doing anything to address these reports? That is, these people have no access to banking because they don't have legal documents. What is the response to the city in terms of safety that would be offered to these people?
Well, I don't have the details on this particular home invasion or what the subject matter was. It's obviously it's illegal and terrible to do that, and very dangerous and scary for the kid. But I don't know the details of it or what the background of it is, but we can get back to you.
En estos momentos no cuento con la información de los detalles con respecto a y esto es algo muy peligroso y obviamente muy atemorizante para esa niña, pero no tengo ni los antecedentes ni los detalles del caso. Una vez que tengamos esta información, le podré dar información a ustedes.
La ciudad sabemos que ofrece, por ejemplo, el City ID para que estas personas puedan tener una identificación para, en caso de necesitar abrir una cuenta de banco. Quisiera que hable un poco más sobre esto y oriente un poco a esa comunidad, y también de que siendo una ciudad santuario tienen la oportunidad de denunciar a pesar de no tener documentos, y la ciudad está para eso, o por lo menos las autoridades para recibir algún tipo de denuncia sobre esta. Si pudiera abundar un poco más el alcalde.
Bien, básicamente quieres que el alcalde le recuerde a la gente lo que ya está disponible para poder resolver este tema, ¿correcto?
Correcto, maybe el City ID y la posibilidad de que se puedan presentar ante las autoridades a hacer denuncias, porque a pesar de no tener documentos, sí tienen el derecho a hacer una denuncia de un robo o un crimen como este.
¿Cómo no? Claro que sí. This is a request for the mayor to remind the immigrant population and immigrant residents of the city that the city offers an ID that enables them to approach a bank in order to open up a bank account.
Yes.
Philadelphia is a sanctuary city, that they also are able to report these incidents of violence without any fear of repercussions.
Can't hear you, Armando.
Sorry, that
Fading
basically.
in and out. You're fading in and out.
I'm sorry, I will repeat, Mayor. This is basically a request that you reinforce the message or remind immigrant populations that the city offers a city ID, enables them to approach a bank in order to open up a bank account. And given that Philadelphia is a sanctuary city, that they also can feel free to report such incidents to the police without fear of reprisal because of their situation as undocumented immigrants.
We'll be working with our Office of Immigrant Affairs and the police to reinforce that message.
Vamos a trabajar con nuestras oficinas para inmigrantes y con nuestra policía para reforzar ese mensaje.
Gracias.
All right. Thank you, Sierra Marie. Let's now go back to Manny Smith of CBS 3.
All right, 3 questions. First one for Mayor Kenny. Not sure if you got a chance to see the endorsement of the Philly Firefighters Union for Donald Trump. Any reaction to that and some of their statements saying that under the Obama-Biden administration, there were significant financial cuts to the fire department?
I believe that their national union may have endorsed Biden, so I don't know what's afoot. It's just Local 22?
Yeah, it's just Local 2, yes.
I mean, I think it's clearly a mistake. Look, my father was a member of that union. I think that Donald Trump would dismantle every union in the country given the opportunity, and he's done so in the past in his private business dealings. I think it's a mistake for them to do that, and we have done nothing but improve and increase our support for the fire department since I've been mayor. So I don't know what that's about, and I don't think it helps them. Wish they hadn't done it, but everyone's free to make their choices.
All right. It's next question is for you and the managing director or acting managing director. We have seen advocates for Red Paw kind of get very active on social media, saying they're just a couple of days away from shutting down, and they're asking the city to get involved, maybe to try to keep them open or extend operations. Any news on that? I don't.
I barely look at social media anymore, and I will check out unless Tumar has some information. We could certainly get into it and find out what's going on.
Yeah, I don't have any info on that, Mayor. We can get back to you, man.
All right, no problem. And then the last thing is we haven't gotten a chance to talk to you, Mayor, since the Christian Dunbar firing. Can you confirm your reaction, how you learned about that from the feds?
Well, I think our city solicitor got a call where the actual indictment came out publicly. We were certainly shocked at what was being alleged. He could certainly not work for the city any longer in those circumstances. What I know right now is what I've read in the indictment, and we'll see how it goes forward with the trial. But it's always sad and disappointing when people are in these situations.
Any investigation and go on into his activities? Yeah,
the Inspector General will review all the activity he was involved in as Deputy Treasurer and as Treasurer, and we suspect that there's nothing there. I think the federal government would have let us know that if there was something there, but we'll check for ourselves to make sure. And there's also other layers of control within his realm of duties that other people look at the work that he does. So I think we should be okay, and we'll check out just to make sure.
All right. Thank you.
All right. Thank you, Manny, and thank you, Mayor. Seeing no further questions, that concludes today's briefing. We will resume next Tuesday. Until then, we will continue to issue the daily press releases. Thank you.